listeners. Welcome back to the Eyecare Experts, Dr. Bell, Dr. Teresa, and we're lucky to have Dr. Johnson with us again for this segment to kind of go through a topic that certainly women's eye health. Eye health in general, we talk a lot about on some of our other podcasts, but certainly with women, females, we're going to get into some things as far as maybe pregnancy, menopause, things like that. That's certainly how it affects the eye health and vision and a lot of other things that go along with that. Do you get that quite a bit as far as patients asking, or what would you say? Yeah.
Absolutely.
Yeah.
Maybe not necessarily about women's health and hormones in general, but it is often that problems or symptoms occur or are brought to my attention that are very much related to hormones and women in general.
Well, we've talked about certainly, and we'll talk about, I'm sure, in future segments, dry eye syndromes, dry eyes, and certainly women, I think in general, I think it's a fair statement to say they're definitely possibly more prone to having dry eye syndromes, vision changes, eye discomfort based on a number of factors. I get the question a lot, hey doc, I'm pregnant or I'm about to be pregnant, what to expect, how is that going to play out with my eyes? And I think a lot of times we cover the refractive and we'll say, hey, possibly during the pregnancy and even 3 or 4 months post-pregnancy, it could affect your prescription, it could affect your vision, and if it does, certainly we'll bring you back in and do another refraction after the fact. But there's things also during the pregnancy, gestational diabetes, preeclampsia, as far as those things. So those are reasons, and those are things we're looking for. Certainly, we're looking at the eye component to make sure the eye is healthy, to make sure there's nothing serious, but also to get you comfortable to treat these conditions, whether they're mild, moderate, or severe.
I personally have not had much complications. The ones that I've had a few of were what you said about the preeclampsia.
Yes.
And that's much more common than I knew about when I was in school. So, but in terms of refractive error, even though it's in the literature, it states that it's 5% or so. I hardly ever see that. I don't see that much. At all. No.
I think mine's low. I think I'm probably 5 to 10, but I usually will warn patients and say, hey, we did the refraction today. It looks like you're seeing very good, but just so you're aware, there is a chance that it could change. And sometimes even if it changes during the pregnancy, for some patients, it'll switch back to what it was before. But I don't know how to predict that. I don't think there is a way to predict where this patient's vision will change and this one won't. I mean, certainly hormones and a lot of factors are factoring into that, but just so they're aware. But I think that's good that it's on the lower end as far as percentages. Is that kind of what you're seeing on the pregnancy as far as that? Yeah.
I'd have to agree. I hear often where they will notice vision changes, but prescription is somewhere around the same, but not necessarily a change in the refraction in the prescription, just more so perception of quality of vision during that time.
I will also, ask patients certainly when they come in, when they're pregnant, and I'll ask them usually blood sugar, blood pressure because of the preeclampsia and things like that. And maybe that, I haven't read too many studies, but maybe that's a big part of it. The patients are having more of those issues, whether it's gestational diabetes or preeclampsia. Maybe those are the ones who have the prescription changes a little bit more frequently than someone who's not having that. I don't know if there's a correlation there or not, but that's possible, I guess. Mm-hmm. But in general, we're talking about prescriptions, but, it could be as simple as, hey, I'm going through menopause or I'm, going through this or that. And certainly it affects the eyes, and I think it affects people differently. So if you're having any of these conditions where, hey, it's blurry or, hey, they're gritty or I'm having to blink or I'm having to put tears in there a lot or, hey, they're red. That's the one I get quite frequently. Hey, my eyes are really red and I don't know why. Can you look at it and tell me why? So there's a lot of things, and maybe one eye's affected more than the other. And if you combine certainly pregnancy with even autoimmune, there's so many things that factor into this. It's not an exact science. And I think the main thing is, hey, we take it case by case basis. You need to come in. We need to see exactly what's going on with you. Is it because of hormones? Is it because of this or that? That way we can treat you and assess you and get you the right treatment and medication if you need it that way.
I think that those very things you're talking about, that complicated etiology, leads to a lot of misdiagnosis too. So a lot of allergic cases are treated as dry eye, and a lot of dry eye are treated as allergies, and a lot of allergies are mistaken for infections of one type or another, or inflammation of another type, which could be related to a systemic condition. I mean, it's fairly difficult to unravel those.
Well, and speaking of that, I had a patient today that came in that had chronic allergic reaction to something. I mean, he had certainly papillae in the lids, but, because a friend told him, or he reached on Google or researched, he was putting warm compresses on that. And of course, that was causing the lids to swell even more. Certainly, we do warm compresses for styes and hordeolums, but usually with an allergy or something like that, it tends to make it swell and make it worse. And so just be aware. Certainly Google sometimes is your friend. Sometimes your best buddy can give you good advice, but certainly come in. If it's bothering you, it's bothering us. We want to see you. We want to figure out exactly what the cause is and get you treated and get you better as soon as we can.
Actually, the latest trend on that is Google may have seen its heyday, and artificial intelligence on ChatGPT gives opinions that are different from Google.
Is that right?
Yeah, so now you can play that game, and then you can make a table and compare and contrast, or you could just come in and get it diagnosed.
So now you can do a secondary diagnosis online before you come in. That's pretty funny. But
while we're on the topic of allergies and women's health too, one other thing that I've seen quite often is contact dermatitis from gel fingernail polish and acrylics too. A lot of times people do not associate any changes around the eyes to their fingernails, but that's actually very, very common.
yes, I have seen quite a bit of cases where it's like press on and then the glue or whatever just kind of seep down into the eye, and I mean it's a bad reaction, and starting to treat that. So I've seen certainly quite a bit of cases like that. I don't know if it's all of them use the same glue, but I know certain ones, definitely your eye's going to have an allergic reaction if it seeps down into there.
Yes.
Depends on the size of those things, too.
Some of them are pretty big.
Yeah.
False lashes, too,
Yeah.
and the glue they use for that will often cause allergic reactions as well.
Yep, for sure. Well, we talked about pregnancy a little bit. Menopause, certainly. With menopause, we talked a little bit about dryness. It could be mild, moderate, severe, but also you're at a point where you get increased risk of glaucoma and cataracts. And certainly with glaucoma, we've talked about this in the past, glaucoma is tough because if you have it, especially in the early stage, you don't know you have it. And that is one reason we want to encourage every patient to have an annual eye exam, even if you see well, especially as we get older, to make sure your eye pressures are within a normal range, to make sure your optic nerve is in a normal range, and you're not getting to the point where, hey, you're pre-glaucoma or you're having glaucoma conditions. Because the treatment is a lot of times just using an eye drop at bedtime. So the treatment is usually nothing to sleep, to lose sleep over. But if you go years and years without eye exam, you certainly, if you have glaucoma, you can lose vision. And once you lose that vision, you don't get it back. So it's very important to come in. We certainly not only check your vision when we do an exam, but that's the reason we dilate you sometimes. That's the reason we ask you all those questions about medications, because we want to make sure, hey, you don't have glaucoma. We want to assess if you have cataracts. We want to assess, hey, do you have diabetic changes? Do you have hypertensive changes? On some of the medications that are using, or are they causing any toxicity? There's a lot of things that we're looking at besides just, hey, what's the best pair of glasses to get you see the best, which we want to do that too, but we also want to do the other things as well.
Oh, I think some of the new technologies for detecting that are amazing. One that we have at the office this year, that we have it at 2 offices, are called electroretinograms. And when you go to your cardiologist, a good cardiologist will always run an EKG or an electrocardiogram, and this is the equivalent of that for the eye, and it's called an electroretinogram. And it's supposed to have a certain wave. We are electrical beings, and our eyes, as our hearts do, function on electrical current. And this thing can measure current in a functional sense way before you'll see any signs or symptoms from any other of our indicative tests. So we have that instrument, and we perform that, particularly if there's a family history of glaucoma or other nerve diseases in the family that are too hard to see, and you can pick them up way before you can detect them by your visual sense.
Well, the more information, the more tests, that helps us, especially with patients where you're trying to figure out, hey, should I start treating them? So the more information I know that I have, the more easier it is for me to kind of figure out how to go about it and the best course to take to kind of treat that patient if we need to treat that patient. One of the things I think you mentioned was blepharitis. Can you talk a little bit about what blepharitis is, how it comes about, what some of the treatment maybe, that you would recommend? What would you say with the blepharitis? Yeah.
Blepharitis is inflammation of the lid and lash margin. Often in older individuals, it might be related to an accumulation of the natural bacteria that's on your skin. Sometimes, hormone changes do have a part in that as well. Blepharitis can kind of come with multiple other things that come along with it, like meibomian gland disease is very, very common. And that leads to other complications down the road as well. But blepharitis is easily treatable and easy to see improvement, whether it's with over-the-counter options or prescription options too.
Well, I know in the old days we used to say, hey, get some baby shampoo and kind of rub there, but certainly those days we've got so many better options nowadays. I mean, whether it's an actual lid wipe or lid scrub, there is actually foaming soap options. Do you have a few that you'd recommend?
I do.
Yeah.
I'm a big fan of hydrochloroacetic acid, and it's a little spritz thing, and it spritzes on you like perfume, and it seeps into all the little spots in the glands, and it's been very effective.
Mm-hmm.
Yeah, because anything can cause, blepharitis. We talk, it could be as simple as, hey, buildup of just skin. It could be bacteria getting there, maybe some makeup left over, dirt, debris, but anything that can clog up those glands. And it starts innocently, but, it starts getting red, it starts getting puffy, it starts getting irritated, and it can lead to some severe things. So certainly we want to get it treated. But that's just, those are a lot of things we're trying to, again, talk about women's health. We've talked a little bit about pregnancy and menopause and how that can affect the eyes. Preventive measures, lifestyle changes. Let's talk a little bit about that, whether it's hydration, omega-3s, adjusting screen habits. We've talked in the past, maybe taking breaks when you're looking at the computer screen. If you're staring at it, you're not blinking typically enough. For every 20 minutes that you're looking at the screen, we take a 20-second break. And I think you said look 20 feet away. So just take breaks, make sure you're looking away, actively closing your eyes, actively blinking. And, as I mentioned earlier, we want to do regular eye exams. We want to look at these things and certainly be proactive as we can. I think the best thing, we talk about new technology, and we're going to be going for a conference here in a week or two as far as, the latest and greatest equipment, and always trying to learn as much as we can. But the diagnostic tools nowadays have reached another level where we're able to kind of pick up stuff at a very, very early stage and help these patients out before it hopefully becomes something, severe down the road.
It's true, and it's become easier to do that, not more difficult. And I welcome that, as opposed to be afraid of. The effect of artificial intelligence on new drug, there was a new company just formed yesterday, according to the Wall Street Journal, called Isomorphic, which was applying artificial intelligence on a large scale to developing new drugs. So apparently you ask this artificial intelligence to solve a particular problem, and it begins to do it on its own through its language machine models, learning models that are incorporated in it. And I think that's good for medicine, and that's a case where it's not to be feared, but to be used as a tool.
Well, we take, a lot of patients will say, hey, what vision insurances do you take? And we take most every vision insurance that's out there, but we also take most medical insurances that's out there too. So, if you're one of those that doesn't have a vision insurance per se, but you have medical insurance that, when you go see your primary care physician, you have a certain medical, well, if we can find a medical condition with the eyes, we can bill that medical insurance. So don't feel that you can't come in, and don't feel that we can't bill that insurance, because most often than not, we can. And we have a medical team, billing team that certainly that helps us to get everything billed appropriately. And we work hard to kind of on the front end to let patients know, hey, this is your insurance. Hey, this is what your copay is. This is what to expect. Because we're not one of those, and we don't want to try to, anything on the back end say, hey, this is what you owe, and it's a large amount. We want patients to know on the front end kind of what to expect and what their insurance covers and that sort of thing.
In fact, in a proactive role, if you have an insurance or need some help on deciding which insurance to get and whether there will be providers for that particular insurance here in town without having to go out of town to get that, we can help. Our insurance department, which consists of 5 people, are very prolific at producing that kind of information, and they know their field well. And we can help you pick one that you can stay with, even though that insurance may not be taken by as many providers. We take most of it, but if you have any difficulties in that, we'd be glad to help you.
Yeah, we've been doing this a long time, and I think one of the hardest things for both of us, or at least for me anyway, is the insurance. Because even with one particular insurance, there's usually different levels of that insurance. And we want to be honest with you about what's covered, not covered, and go through all of that. So, but yeah, just give us a call. We may be booked out. I know there's some offices people will call, patients will say, hey, you guys were booked out a couple weeks. And hey, we may be booked out a couple weeks for a full exam, but we do leave empty slots, open slots for office visits. So if it's, an emergency, if it's really hurting you, it's red, you got an infection, you got something hitting the eye, it's painful, give us a call, because we'll get you worked in. If not the same day, we'll get you worked in as soon as we can, because we want to get that addressed.
And actually, that problem has been greatly alleviated because we have a new office in Navarre, a new office at Baptist Hospital, and a new office at Fairhope. So you can get in fairly quickly at this stage of the game.
And that's because of you guys. We appreciate it. We've been expanding. We've been trying to get in the Navarre market for a while. We're very happy to be there. And we're open, ready to see you. So we appreciate it, because we wouldn't be in the position we're in right now if it weren't for the patients and the trust that you've basically shown in us. So we appreciate that.
That's correct.
We talked a little bit about dryness today for this women's health, but certainly stay tuned for future podcasts. I think we're going to have one coming up real soon specifically on dry eyes and how it affects, and go in depth as far as all that entails. But we certainly appreciate y'all listening. We can't thank you enough. Let us know any questions or concerns or any topics. Thank Dr. Johnson again for joining us. Dr. Teresa, we appreciate it. But we'll see you next time. Thank you.